Today we're going to look at polymyositis, a rare chronic condition that falls under the group of idiopathic inflammatory myopathies. The incidence is low, estimated at about 2 cases per 10,000 adults per year. It occurs more often in women than in men, about 2 to 1, and it usually develops between the ages of 40 and 50. Polymyositis is considered an autoimmune condition because autoantibodies are present, although interestingly, these antibodies don't directly cause damage to muscle cells. Instead, they seem to play more of an indirect role. The disease process is multifactorial, involving both cellular and humoral immune mechanisms. The clinical picture usually begins slowly and insidiously. Symptoms may progress over weeks to months, and the most common initial finding is proximal muscle weakness. This weakness is usually symmetric and widespread. Patients often describe difficulty rising from a chair, climbing stairs, or even holding up their head. Myalgia and muscle tenderness occur in about 1/4 to half of cases. A closely related condition, dermatomyositis, is distinguished by a rash, an erythematous smooth or scaly lesion that appears over joint surfaces. For many patients, this rash shows up before weakness begins, making it an early diagnostic clue. Diagnosis starts with a thorough history and physical exam, mainly to rule out other causes of muscle weakness. There isn't one single test that confirms polymyositis. An electromyogram can help exclude degenerative muscle disease. A muscle biopsy often shows inflammatory infiltrates, and serum studies reveal increased muscle enzyme activity. These findings, taken together, help establish the diagnosis. Treatment typically begins with corticosteroids, which remain the mainstay of therapy. If patients don't respond adequately, other treatments may be considered, including intravenous immune globulin, plasmapheresis, lymphopoiesis, or even total body irradiation. The goal across all therapies is to control inflammation and prevent long-term damage to muscles, joints, and organs. For patients who develop skin involvement, the anti-malarial drug hydroxychloroquine can be useful for treating rashes. Physical therapy plays an important role as well. It usually begins slowly, starting with range of motion exercises to preserve joint mobility, and then progressing to gradual strengthening exercises. Nursing management for polymyositis builds on the same principles we've used for other rheumatic conditions. The key nursing diagnoses include impaired mobility, fatigue, self-care deficits, and lack of knowledge about self-management techniques. Because proximal muscle weakness is so characteristic, daily activities like combing the hair, reaching overhead, or walking upstairs can become difficult. Nurses play an important role in teaching patients how to use adaptive strategies and assistive devices. Referrals to occupational and physical therapy are often essential to help patients maintain independence and quality of life.